My name is Tel Ganeshan. I'm the president of TiE Detroit. I am here with Dr. Partha Nandi, one of the most passionate, compassionate, driven physician that I ever met. So thank you, Dr. Nandi.
It's my pleasure, Tel. Thanks for having me.
Yeah, so just want to ask you a couple questions as you are the grand keynote speaker for the TiECon. You touch people's life every single day. What does medical innovation mean to you?
Medical innovation, especially in the realm of what we're talking about with TiECon, is how technology has disrupted in a positive way.
Sure.
Medicine and its delivery. So I'll tell you that we now know that patients can access us through the technology that we have developed and do it in a way that's efficient without having to wait for the doctor. So, for example, if you're trying to see the doctor and you
Sure.
can't see them until December 2016, and you don't have to wait anymore because there are patient portals. There's ways in which you can communicate with them, and that technology has really been important. So for me, when you were kind enough to ask me to be a speaker
Yes.
for this event, it was exciting because the entrepreneurs that are here are really developing that technology
Sure.
and disrupting the technology so that we can deliver better care.
Sure.
And if we can do that more efficiently without patients having to wait and wait and wait, I think that's wonderful.
That's great, yeah. So, obviously in the technology realm, there's a lot of startups. It's all over the place. The energy is very contagious, even in Detroit, is coming back. But we're not seeing enough entrepreneurs in the healthcare innovation arena. So what are some of the things that we can do to see more healthcare entrepreneurs?
I think that's a great question because you're right. We need a little bit more of folks that want to do this disruption. They want to change
Yes.
the paradigm. I think two things happen. Is that the technology often are not complementary. So we have, for example, electronic medical
Sure.
record systems, but they don't talk to each other. So you have different systems of technological innovation, but they often compete and they're not complementary. I think you would agree that the saying that all in a rising tide, all boats will rise. Right?
That's right.
So we can then work together. I think more and more people are realizing in healthcare, as they have in business, that if you can then develop technology that's complementary, you and I could both do well and help the.
Okay.
That's what I think is missing. And secondly, people who deliver healthcare,
Sure.
where our mindset is a little different than in business, as far as process management, as far as efficiency.
Sure.
We are not trained that way. But I think now we're realizing in order to do what we want to do,
Okay.
which is get the best care for the patient, we need to develop those technologies. I think that's going to happen more and more. And that's why it's so important that conferences and
Sure.
meetings like yours happen so people know what others are doing so they can jump on and say,
Okay.
you know what, I want to do the same thing.
So are you telling us the physicians are lagging behind technologists?
Absolutely.
Oh,
I think that some physicians actually see technology as a hindrance because it's one more thing you have to do. So you feel like, I should be talking to the patient instead of doing that. In certain cases, it's true.
Sure.
But what's happened is that it's made our care more efficient. It's made it more applicable to patient.
Okay.
And like I said, this morning, I did procedures. In between procedures, I was able to take care of 30 messages from patients.
Okay.
Patients that had medication side effects, patients that had problems with therapies,
Sure.
patients that had questions about their family. Normally, in the old days, before you had such technology, we would answer tomorrow or later today.
Later, that's right.
That's just too late. Now we can do it instantly. We send it to our nurses, or we talk to patients ourselves, and that problem is solved immediately, not hours later. And that's a massive difference.
It is a huge
You're
difference.
Friday afternoon, and you're worried about your mom, and you get the question answered right away. Take this medicine, this combination. That's revolutionary.
Sure.
That's why it's so important. When you told me about this conference, I said this is right up our alley because things are happening now that didn't happen, during our father's generation
Yes.
or even 10 years ago. That's really changing patients' lives.
Okay. As you know, this conference is all about entrepreneurship, right? So what are some of the areas in healthcare where it's currently not being served that an entrepreneur can work on? And what kind of opportunities you see in that area?
It's a good question. I think that the main problem is that the providers, such as myself, and
Sure.
the patient, the technology doesn't always fit our needs. So, for example, doctors and nurses and providers are not able to talk to the programmers, the people who are trying to make the innovation, say, this is what we are looking
Sure.
for. Conversely, patients also, a lot of our patients are elderly. We love for that there be input with the patient when these innovations are taking place, so it's more user-friendly. If that happens, I think that's a huge opportunity for innovators and entrepreneurs to take input from the patient as well as the provider. Have them when the think tanks are there, when the solutions are being created, so that it's useful for us.
Good.
Otherwise, it doesn't apply, and we can't take advantage of these awesome technologies.
So as you open the window to the healthcare mobility, what are some of the key takeaways for the audience that's going to come to TiECon?
It'll be exciting because what I want to
Okay.
talk about is how this mobility technology, these platforms and solutions have affected my life as a
Okay.
physician and as a caregiver. Both my father's had a stroke, my mom's ill, so I also see it from the other side.
I see.
As a patient and as a provider, it's revolutionized what we're doing, and it's made it more exciting to practice. It's made it better as a patient.
Okay.
But I think the future is even brighter. I love social media and what it's doing for that platform. For example, as a practice, we can give information we couldn't give before.
Sure.
And in a way that's not foreboding. That's not a place that people don't want to go
Mhm.
to. You go to a doctor's office, and sometimes it is the scariest place you want to go to.
Sure.
And so people stay away from it. If we have a conduit in which we can approach them through social media, it'd be great. So these are some of the things I'll be talking about, that what the future is excellent, and I mean what the present is excellent, and the future is even brighter.
That's right. That's right. So as you know, at our TiECon, you're going to be wearing multiple hats, actually 3 hats to be specific. You're going to be grand keynoting. You're going to be moderating a panel. Also, you're going to do a fireside chat with Nancy, the CEO of Henry Ford Health System. So thank you so much for your involvement, and I look forward to seeing you at TiECon.
Thank you for the invitation. I hope everybody comes out.
Absolutely.